Hi guys, so today we're going to talk about nursing care of the child with a cardiovascular disorder. Disorders with decreased pulmonary blood flow. These are what we call cyanotic disorders. If you have decreased pulmonary blood flow, you are going to be blue. So these are tetralogy of Fallot and tricuspid atresia. Tetralogy of Fallot is one of the most commonly tested upon nursing cardiac diagnoses in pediatrics. So they do ask questions about this one. Tetra means four. So just remember there's four problems within the heart that cause this disorder, the tetralogy of Fallot. And the four problems are that there is pulmonary stenosis, so it is obstructing blood flow. There is a ventricular septal defect. I like to think of the septum in your nose. If it's messed up, you have a hard time breathing because it's decreasing the patency, the lumen of your nostril. Same thing's happening here. A ventricular septal defect is obstructing the flow. There is an overriding aorta, which means the aorta is kind of going over the top of something that it's not supposed to be, which is also obstructing the flow. And then there's right ventricular hypertrophy. So if it is too muscular, if it is too thick, it is also obstructing the flow. We're not going to talk a whole lot about tricuspid atresia. So what I want you guys to know about tetralogy of Fallot is that they're going to be blue. They might have surgery. Well, they're going to have surgery to fix a lot of these issues. Most of the time, it is over the course of their life. So in their 20s, they might be having their fourth or fifth procedure on the pulmonary arteries. The septal defect is something that can be fixed and usually stays fixed. Tricuspid atresia is where the little valve in between the right atrium and the right ventricle just doesn't develop. So there's no real good blood flow from the right atrium into the right ventricle. It allows pooling, all sorts of different things. So we're letting systemic blood coming back from the systemic circulation into the right atrium. It can't go into the right ventricle to get pumped because that valve is not correct. So the tricuspid valve, remember that we have a mitral valve, a tricuspid valve. This tricuspid valve did not develop. Again, they will be blue. Cyanotic. So if you can focus on knowing that tetralogy of Fallot and tricuspid atresia are cyanotic disorders, you will know that they are a disorder of decreased pulmonary blood flow, right? If you're blue, you're not getting blood flow to the lungs. These kids are going to have color changes every time they try to eat or play or cry. Hypercyanosis is something that happens really suddenly, and it can happen when they are upset, agitated. So when we have this occur during crying or feeding spells, we can try to fend this off by doing what we call a knee chest position. So we're going to bend their little legs up at the knee, push their knees onto their belly or their chest, and this kind of smushes the pressure back up to the heart and the lungs where it needs to go. A lot of children that are already walking, you're going to see them squat down on purpose. It's like their body knows they need to do that. I'm not saying that every kid that squats has a cyanotic cardiovascular disorder, but if they're doing it when they're playing, crying, agitated, and they're doing it frequently and just kind of hanging out there, they are resting, they are recovering their blood flow. We're going to listen to these kids' breath sounds. Even though we're talking about heart disease, their lungs, obviously, because they're blue, are going to be involved. Any adventitious breath sounds like rails, rails, crackles, coarseness, if we hear those, we're going to look towards the development of heart failure. These types of disorders should also have this loud, harsh murmur. Again, most people have to be pretty good at hearing murmurs, even when they're loud and harsh. So you can see that in tricuspid atresia, if you're following along with your notes, this includes an atrioseptal defect and a patent foramen ovale. These kids are going to have really poor feeding, weak sucks. And when they do have the energy to suck, they're going to tire out really quickly. We will work with them as much as we have to try to decrease their work during eating. Okay, patent ductus arteriosus, second most common. It accounts for 10% of childhood congenital heart disease. Let's get into it. This one increases the workload on the left side of the heart. We're allowing it to go into the pulmonary arteries. We're allowing it to go back into spaces where it shouldn't be. We're increasing the pulmonary pressure, and we're going to get right ventricular hypertrophy. For this one, I want you to know that you're going to have a harsh, machine-like, almost like a washing machine sounding murmur, and it's continuous. So we have blood, instead of going into the systemic circulation from the left ventricle, it's going the wrong way. We're going to get pulmonary vascular congestion, increased pressures, right ventricular hypertrophy. I need you guys to know that this, just like every other one of these whole type malformations, the symptoms are going to be completely size dependent. Not the size of the child, the size of the hole. So if the hole is tiny, that kid might not have any symptoms and it might not need to be fixed. There are going to be kids that have much larger spaces or holes and it needs to be surgically repaired. These kids with patent ductus arteriosus are going to have frequent respiratory infections. I need you to listen to them for rales, which is indicative of what? Heart failure, not a good thing.